Okay, so here is the setup for Botox, okay? First we have our ComfortTox syringes. Sometimes we use ComfortTox as a brand, sometimes we just use what are called tuberculin syringes that are the same size. They might be like orange instead. These syringes, by the way, are all one piece, so you cannot remove the tip of the syringe. This entire thing has to go in the sharps container. So heads up on that. This is a larger 3 mil syringe, and this tip can be removed. So this tip throws separately into the sharps. The plastic piece can go in the garbage can. And this we only need if we're opening up a new box of Botox, because we have to hydrate it. So that's when we need this. This is bacteriostatic saline, basically, sodium chloride. So we'll use that to reconstitute this one, okay? Then on the tray, we have some dry 2x2s to soak up any drops of blood that might come out. It's usually not a lot. We also have alcohol 2x2s that are used to clean the skin prior to injections. The other thing that's important here is once we decide how many units are gonna go in each area, oftentimes I'll write on the paper here how many units were put into each muscle. So then it's going to be important to record that in the chart note to say how many units, which muscle, etc. And then sometimes I'll use the pen to mark areas on the skin for injection as well. So, okay, and that is our Botox setup. Okay, one more detail when we're finishing up the Botox. We just finished, and left in this vial there are 64 units. So I'm going to take a pen and just write 64U on here, and then today's date. I'm also gonna write it on the box, and we'll just keep this back in the box. And then this has to go in the fridge now that it's reconstituted. And we typically use this within about a month. Make sure to write today's date and how many units are left. And do not throw away any Botox vials that have more liquid left in them, because you could potentially throw away hundreds of dollars of Botox. Thanks.